Over to you.
Good afternoon. Good afternoon, viewers at home. This is Cape Conference, the Youth Ministries Department, presenting a talk this afternoon about depression and anxiety. Before we can engage on the discussion, we will invite Pastor AJ to open this discussion with a word of prayer. And I'm going to invite him to pray for us. Will you please pray for us, Pastor AJ?
Let's close our eyes and we can pray together. Father, we'd like to thank you that we have this privilege of being together, even though it's over media and that we're far away from each other. We'd like to thank you, Lord, for keeping us safe and protecting us and going with our families. And Father, as we come to you this afternoon, we'd like to pray that you may bless this discussion and that every person watching this recording, Lord, will actually see that your grace abounds in their lives as well. And we would like to pray for all those who are battling with anxiety and depression, and that they can see that there's truly an awesome God in life today. Thank you for hearing our prayers, and thank you for blessing us abundantly, Father. Be with us now, and may your grace abound in everything that we will discuss. We pray this in your name alone. Amen.
Amen. Thank you so much, Pastor AJ. My name is Bulelani Bomela, Cape Conference Youth Ministries Department Director. This afternoon, we are inviting all of you at home in the comfort of your homes or wherever you may be, and hopefully you are at home because you're supposed to be home. We invite you and thank you so much for tuning in to our discussion this afternoon. As I said, we will be discussing a topic, depression and anxiety. And the question is, as young people, do we go through such stuff? And this afternoon, we'll be looking into that, and I know some of you are already nodding heads as to say, yes, we do. But we will be looking into that. We have our guests who are actually working at the General Conference of the Seventh Adventist Church. And at this point in time, it's time for introductions. And two of them we have will be introducing themselves, and then after which the vice chairpersons for the 6 YCOMs in the Cape Conference will introduce themselves together with the directors. And I'm going to hand over now to our guests to introduce themselves, and we are so glad to have you. Over to you.
Katya, you go first.
Who's first?
Okay, I'll start. Well, my name is Katya Reinert. I am one of the associate directors here for Health Ministries at the General Conference. I have a passion for this topic that we're talking about as a nurse, as a clinician, seeing patients, and also ministering in the global church in this aspect, talking about mental health and this. So I'm looking forward to talking and discussing this topic among this wonderful team here. So it's a pleasure to be with you this evening.
Thank you so much. Welcome and enjoy the discussion. Who's next?
Well, I guess I can go. My name is Torben Berglund. I'm a medical doctor and with a specialty in psychiatry and also a psychotherapist. So, and I've worked quite a lot with these topics, primarily with adults, that's people from 18 years and older. But this is something I worked a lot with. I find it very interesting and happy that we can put focus on it now, and especially in these times that we're living in, which are challenging for many people. And even if you haven't struggled with anxiety and depression before, maybe you will find that yourself or some people will find that they will experience more of that in these times. So happy to be able to be here and share with you.
Thank you so much, Doc. As for us, Cape Conference, we really appreciate the fact that you have agreed to be part of this discussion, and so that you can share with us some information on depression and anxiety. At this point in time, I'll be going to my core youth ministries directors of the conference to introduce themselves.
I think let's start with, I'll start from my side. So my name is Pastor AJ de Villiers. I am the youth director in the Western region of the Cape Conference. We've got a very big conference, so we are divided up into 3 regions where we work together as youth departments. And yes, the Lord's blessing us, and our youth department, I guess, at this moment is growing socially on social media. So once again, welcome together. And maybe I can pass on to Zanele, and she can then explain.
Thank you, Pastor. Thank you, Pastor AJ. Who else is here from the Western region?
Sister Nomana.
Okay. Hi. My name is Nomana Makazi, based in Mossel Bay, the Southern Cape. I'm the vice chairperson of the ambassadors.
Thank you so much. Welcome, Sister Nomana. And I move to the Eastern region, Unit 3, WICOM 3. Who do we have there?
Got Andy Swampiko. Good evening, everyone. My name is Andy Swampiko. I'm the Vice Chairperson for Unit 3, serving under Pastor Pomela. It's a pleasure to be part of this meeting.
Thank you so much. It looks like we have someone who wants to come in, Pastor AJ, and I have just allowed him to come in. And he will introduce himself after we're done with the WICOM VCs. Now I move to Unit WICOM 2. She's probably not in yet. That will be Sister Dozini. Can we quickly go to Unit 1?
She is in, Pastor Voms.
Is she there?
Yes.
Hi. Oh, yeah. Talk to us. Who are you?
Hi, my name is Cindy Swandozini. I'm VC for Unit 2.
Thank you. Thank you so much. Welcome, my sister. Unit 1.
Greetings, everyone. I'm Zanele, VC Ambassador, Eastern Region, WICOM 1. I'm in Amtata. Happy to meet you.
Thank you, Zen. Welcome. All right. Thank you so much. This is how we're gonna be rolling out our discussion this afternoon. We will first give an opportunity to our guest speakers to actually present to us as to what is depression, what is anxiety, and all the small nitty-gritties around depression and anxiety, after which we will then ask some questions which our VCs have prepared. And these are the questions, by the way, which are coming from you viewers at home, from our ambassadors who are actually watching and are waiting to hear what will be the responses and the answers to their questions. And so at this point in time, I will, without wasting time, go straight to our guest speakers and invite one of them to begin the discussion. Then after which we will have a little bit of a pause, a break, as we prepare for the second one to come in. All right. That was just a call from one of our ambassadors, maybe. Okay. All right. Thank you so much. I will hand over to our guest speakers from the JRA conference to begin the discussion. Over to you.
Well, I can start, but we'll do this together, support one another. Neither of us is all-knowing, so and we'll support one another and try to get across most important messages. But I'm really happy that you decided to take this opportunity to talk about depression and anxiety, because those are such common issues in the whole world and also among young people. When we talk about physical illnesses, sometimes it's like the older we get, the greater the risk is that we'll catch something and eventually we will die from some kind of bodily dysfunction. With mental illness, it's somewhat different in that sort of almost regardless of age, we are all sort of at risk of potentially developing a mental illness. So it's not like the older you get, the more people have mental illness. It's rather, they see especially like a peak in many ways when young, like teenagers and young adults, and then sort of we have another peak like typically later on in life. So dealing with mental illness is something that is important that we talk about, also because many young people will have issues, varying degrees of issues. And I think sometimes there's a lot of stigma around mental illness that we need to deal with, and there's lots of shame around mental illness. And I would like to, from the start, say that that's very unfortunate, that we attribute shame and feel shame regarding mental illness. Mental illness is something that is a quite natural occurring thing in the world we're living in, because the world is not perfect. If the world was perfect, if the world was like from the Garden of Eden, the way God created it, then we wouldn't have any mental illness and we would not have any physical illness. But the world we live in is not perfect. And we are exposed from very early on in life to all kinds of bad things happening. And we hear about bad things happening to others. And this makes the world a quite sort of dangerous and scary place to live in. And because of that, some of us have reactions to that that can then develop into a mental illness. So like I want to say, especially to young people who may be experiencing struggling mentally, recognize that they are having thoughts and feelings, reactions to things happening that are difficult to deal with. That sort of it's important to understand that these are often quite normal things in a world that is difficult to live in. And when we're talking about anxiety and depression, those are the most common illnesses in the world globally. We estimate that sort of at least 250 million people suffer from depression or anxiety, or both. So that it's a big proportion, many people around the world who are struggling with this on the level where we will call it an illness. People can struggle with anxiety and depression, like symptoms of that, without it being like defined as an illness. But it becomes something that sort of significantly impacts your quality of life or your ability to function optimally. That's where you sort of cross the threshold of what we would define as an illness. So that's something to be aware of, that this is something that should be taken seriously, sort of whether it's symptoms or it's an illness, it should be dealt with well, like, and appropriately, so that people can have a better life, so that we can have a better life. But especially when it becomes an illness, when you struggle to function, or the quality of life is not as good as it otherwise could have been, that's when it's important to consider to take measures to get help. So that was just like a big picture sort of perspective, some context on that. So I don't know, Katja, if you would like say something more specifically about anxiety and depression. I think
Yeah, I think one of the things I have found, and as I think back, even talking to some young people in your conference, I've been there before, several years ago, in a big meeting, talking to women in George, where oftentimes you have that beautiful location where you meet, and I remember talking to a lot of our young women that were there, because as you know, I don't know, you probably know, we should say that women are more at risk for depression than men are, twice as much according to the numbers. And it seems like the prevalence among women it is twice as much as men. And so I remember talking to young women there, and they did not realize, because for some people, they do not know that what they're experiencing is impairing them in a way that actually they do have a disease, like a depression. There's a name to it. Some young people grow up in an environment and in the way that they are taught to deal with their feelings, and they think, what, this is just normal. Everybody goes through this. What I'm feeling, I think it's just everybody's feeling, and so I just have to deal with this. And it wasn't until we would talk about the signs, the symptoms, talk about the structure, like what Dr. Berglund just mentioned. Yeah, sometimes you can just have feelings or symptoms and not necessarily be a disease. So you have to understand, when does it go through that threshold where you're really struggling, trying to study, trying to learn, trying to fulfill your responsibilities as a son, a daughter, but also in school, and maybe you're working as well, or helping in a family, and you're really struggling to be able to do that. I remember in one case, one young woman, she was actually dealing with that by going behind the scenes and drinking and doing other things to try to feel better about herself, because she felt so terrible about herself. She just felt low, had no energy, had issues with sleep, had lots of the symptoms we can talk about later. But she didn't realize that actually, she could get treatment. There was something she could do to feel better, because that was not normal. That level of some of the symptoms that she was having was so high. But nobody knew. Her parents didn't know. She wouldn't share what was going on because it was expected that she had to deal with her life. And so it's very common. And sometimes we just want to tell people, if you are feeling, and hopefully we'll go through what the symptoms are, if you are feeling those things and you are having that, you can seek help. And realize that there is there are things you can do. There is help you can get that can help you feel better and deal with that. You don't have to live with that forever, thinking it's just, this is life. There is good things you can do to feel better, and there's hope.
I think that's very important what Katja is saying now, that many people that can struggle mentally without realizing that this is an illness and this is something that is treatable. And that's very unfortunate. Like, for mental illness, many people go with these things for years and years before seek appropriate treatment. And that's unfortunate, especially young people, where these years are so important in terms of education, in terms of finding a partner, establishing a family, whatever you sort of are important. These years are where you shape the future very much. And that's why I encourage that if people have some sense that there's something wrong, then seek professional help. You don't need to know what is your problem, but that's why we have experts. That's why we have professionals. So you can go and tell them, I think there's something wrong. There's something I'm struggling with. I don't know quite what it is, but can you help me to understand what this is? And then to get appropriate help for that.
Yeah. And perhaps, since we're introducing this topic, it will be helpful to talk about some of the things that actually, the young people listening right now can perhaps look for and check their own lives and say, okay, yeah, I'm feeling this, because it is if we start with depression, for instance, impacts your mood, impacts how you feel quite a bit. And so some of the common things, two of the very common things that, if we're going to say diagnose depression as a major depression, a disease, a couple of the symptoms that usually are present, one or the two or both usually are present. One is there is this loss of pleasure in life. There is sadness, a deep sadness with sometimes no explanation. Sometimes there may be, a loss of someone or an issue that the person is struggling with. And so there's that deep sadness. But sometimes there may not even be an explanation. The person just realizes that I don't feel joy. Or sometimes there is a change. They used to feel in a certain way, and now suddenly they've lost that. And it's not just, that doesn't happen just one day and another day. It happens every day for, 2 weeks at least or longer. So it's not just a mood change per se, but it's something that is there and, day after day. And they just don't know, why am I feeling so sad? Why am I having this feeling that I want to cry all the time, where I'm feeling so desperate in this way. Another one is also related to various things that you can have. One may be problem sleeping. Somebody who either sleeps too much for too long, or just can't fall asleep, or gets up in the middle of the night and can sleep again. So there's disturbances in sleep patterns. There may be issues with concentration among young people. This is very common. They want to study, get and read and really concentrate on learning, but there doesn't seem to be enough ability for them to concentrate and learn. Their mind goes everywhere, and it's very difficult for them to focus and learn. That may be another symptom. Perhaps another one may have to be with sometimes, just a feeling that they are not worth anything, that if they die, nobody's going to miss them. So it's kind of like they see themselves as unworthy of living even, and that nobody cares about them. So this low self-worth, this idea that, nobody really cares about what happens to me, and of course, among young people, a very common one is that can actually go deeper and lead into thoughts of that death and dying and really suicide, which is, again, among teens is a top killer. I think, and Dr. Torben can correct us, but I think is number 2 in many places cause of death among young people. And that's why it's so important for us to be able to start to identify some of the symptoms. Maybe Dr. Turban was add other symptoms along. I don't want to just talk only myself. You want to add a few others? There's more.
I think you covered most of them. One thing I would sort of add is like this feeling, the lack of energy or fatigue that can be sort of very difficult to understand. What is this actually? And then sometimes people are just tired. They don't have energy to do the things that they used to do, and they don't have an interest in doing the things that they used to do. But for example, this tiredness, fatigue thing, it's a very good illustration that why you need professional help, because that's fatigue, tiredness. It's a symptom of many kinds of illness. It can be physical illnesses. It can be vitamin deficiency, metabolic disturbances, these different things like metabolism, not metabolic. I'm sorry, I'm Norwegian, so sometimes I get the words wrong. So you have to correct me if I say something that is nonsense. But it's a good example of where something like being tired. There are many kinds of physical illnesses that can give that, and depression and anxiety can actually be symptoms of physical illnesses. And that's why it's important sort of not just to think, well, I think I'm depressed, so I will do this and this and follow this kind of advice. Like, it's good to sort of do the right things, but still you should have a physical checkup to assess what are the potential issues. Is there any kind of physical disturbance that need to be corrected, rectified in this? And sometimes the mental symptoms will go away if you correct that underlying physical illness. And that's why it's so important, and I can't stress that enough, that people seek professional help whenever that is available, and not just try to treat themselves. That's why we have professional, because this is complicated stuff.
Yeah, this is so important, and perhaps it will be helpful to talk about, like you just mentioned, what are some of the causes of this? Because when you treat the cause, that's when you can actually get better. So you mentioned one of the causes, which could be related to medical conditions, diabetes, hepatitis, disturbance in hormones and other things can lead sometimes or increase the risk for that. I think there's two unmodifiable causes that have been documented a lot. One may be hereditary. You have sometimes an increased risk because in your family history, your grandparents, your parents, or somebody in your family may have depression that may increase your risk. So there are several risk factors. This is one you cannot change per se. There's others that are related to development. So young people, for instance, that perhaps experience child abuse or some kind of break in their bonding with their family or family connections or relationships early on, or even as a teen, if they're having dating violence, experiencing things or some kind of abuse or trauma from early on into this, we're talking to teens, so until their adolescent years here, but even beyond, that can be also something that they cannot go back and change that, so it's an unchangeable kind of risk factor per se, although there's things you can do to deal with that. But many of these other things that are risk factors, there can be things you can do, like in case of medical condition that may be a risk factor, you can go and get that cause fixed by getting an assessment and treatment for that. But there are also other issues. There are patterns that can increase your risk. So like, for instance, sleep patterns. Among young people, sometimes we see that sometimes there is no time to go to bed. You want to study through the night, so you neglect sleep, and that can actually increase your risk of having symptoms related to, depressive symptoms. So sleep, your routine for sleep is important. Another risk factor could be, even what you are, your diet, and if you're lacking nutrients, for instance, that may also have an impact. We know that tryptophan is one of the things that we need in our body, and some people, few, apparently have a lack of that, and it's in some foods that we eat. Other kinds of vitamins too, omega-3, some other kinds of things. There's some nutrients that are important for our mental health, and so if we're not eating a healthy, balanced diet as much as we can, maybe that can be a nutritional thing that we could also correct. One of the most common ones, though, is stress related for a lot of people. I think the kinds of trauma, if you've been through war, if you've been raped, if you've been neglected in some way, of course, in many of us, it's very common that we go through hardship in life, but some people really go much deeper and experience a lot of that stress, and that cumulative stress can actually be as well an added risk factor or root cause. Do you want to add some others, Torben?
Well, I think maybe we can. I know that you've prepared some questions for us, and I think we're already going into some of those questions. So maybe we can get back to that. I think maybe if you do just a short introduction on anxiety, also just to give some background on that, so we know what we're talking about. Just like a very sort of simplified way of saying this is that in the way you can say depression becomes like that you develop a hypersensitivity to negative things. We know that when people are depressed, they have sort of what we call a cognitive bias. So they pick up negative things in their environment, maybe because they have experienced so many negative things. So you become sort of hypersensitive to that. And then sometimes you don't recognize, and the good things that happen, sort of you overlook them. And of course, when you continue to look at the negative things, this is not something people choose to do. This is something that happens for physical reasons or psychological reasons or whatever. So it's not a choice. So you can say, like, very simplified, like, and it's always dangerous to simplify because it sort of doesn't cover the whole thing. But if we say very simplified, depression is very much a hypersensitive to negative things. Anxiety is a hypersensitivity to danger, like things that are potentially risks that you see in your environment. So the core thing in anxiety is that people are excessively afraid, fearful in various kinds of ways to something. And when we're talking about anxiety, we have, like, in terms of the illnesses, we have many types of anxiety. We have, like, what we call, like, the worrying type of anxiety, where people just worry excessively about everything that could go wrong. It can be other kinds of more specific fears, that you're afraid of social settings, you're afraid of being in specific places, you're afraid of snakes or spiders or mice or needles, that kind of things. So in a way, we could say we diagnostically, when the illness, that we are a bit more sophisticated when it comes to talking about anxiety than we are depression. In depression, it's sort of just a big sort of stack of thing we call everything depression. But my understanding and my opinion is that depression is very much like anxiety. Also, there are many kinds of depression, but we don't label them at, like, this is this kind of depression and this is this kind of depression. We're not very sophisticated in the diagnosis of depression. And that's why it's important to understand that. That's again why we need professionals, so they can figure out what is the problem, what is the issue in this situation, and what is the appropriate treatment. Because one person with depression and another person with depression, it can be very different causes and also very different kinds of treatments they need, and they are different personalities, so they may need different approaches to that. So, but again, just sort of as an introduction, anxiety, excessive fear to something, like we need to be afraid in life. We need to be to have anxiety at times when we are exposed to real dangers. But when your reaction to a real danger or an imagined danger or a perceived danger, when that is excessive, that's when we may call it that it becomes an anxiety illness. So just some perspective. Katja, I don't know if you want to add to that.
And it's important to highlight that oftentimes we see depression and anxiety together, and you know, not all the time, but it's common, they can happen together. And another thing that I want to mention, there is also bipolar depression, which is just important to know. There's various types of depression. Sometimes depression comes on alone when you pull, but then you also sometimes have times when the person feels depressed, or it goes through other times where they are hyperactive and high. So it's a different kind of dynamic, if you will. But many times people don't know they are bipolar. They sometimes are diagnosed to be just depressive, because that's when they seek help sometimes. And so oftentimes we miss that other one. I just want to bring that in because, again, it goes with what you're saying, that there's different types of how it presents. And so we have to seek help from a professional to be able to differentiate, as they do a very thorough kind of evaluation to see, is it just depression? Is it depression and anxiety? Is it a bipolar depression? To kind of, you know, see what best way to help the person.
So, like me and Katja, we could probably continue talking till tomorrow morning on these things without needing to say anything. So, but I think, like, just let's, I know you have prepared some questions, and even if we touched on it, we can sort of go deeper into it now. And feel free to ask whatever questions. Maybe we say something that needs more clarification, or that you become curious about something. So let's just go for it.
All right. Thank you so much. Wow, I was trying to write a few points here. I'm even at the point of wanting to punch my face for some of the experiences I've seen, and I've been judgmental about them. I mingling with ambassadors, especially ambassadors, And I've seen a few of them who would have a certain behavior, and I would say, I have panic attacks, and I mean, look, when I first met this kind of behavior and experience, I was like, okay, I think you are just an attention seeker. I mean that, and maybe that's the danger. Maybe that's the danger we're facing with youth leaders. We are unable to see these things, and then we could quickly make conclusions and wrong conclusions. Hence my question this afternoon. Panic attacks. What is that? I mean, where does it come here? Is it anxiety, or does it fall under anxiety? Is it someone who is depressed? What is that? If a child says, I have a panic attack, what is that?
Well, panic attacks is one type of anxiety disorders. So you can, and again, you can have other kinds of anxiety disorders and have panic attacks as well. What I think is important to understand and recognize that whatever label we put on it, it doesn't mean sort of necessarily that you have, if you put several labels, that you have anxiety and depression, that you have two illnesses. We're talking about one person. But we're using these labels to try to understand what's going on and try to explain. So we have a language to communicate, so we know what we're talking about, and also can know how to deal with it. Just to explain, like panic attacks, what they are, they're typically, like, they're defined that they are extreme attack of anxiety, that sometimes they just come out of the blue, they come quickly, and fortunately they go away, like usually in a few minutes, but it can be terrible while you're in it. And people even can feel that they are dying, they can feel that they're going crazy, and like the behavior will maybe be very strange also in this situation. Some people can have panic attacks also, and they can just conceal it so that others don't see it. But still, what you may see, that they may sort of withdraw from the situation. They will go quiet, different things. So it's difficult to sort of know just by looking at the person what's going on. But panic attacks is a quite common issue. It's a quite common anxiety disorder, and it can be difficult to know sometimes exactly why. That's one of the anxiety issues, that sort of like, why am I struggling with this? The problem often with anxiety, panic attacks, is that people, because it's so unpleasant and it's so scary when it happens, then that they start worrying a lot about it happening again, and they're starting to like take all kinds of precautions, being careful not to have it happen again, or avoid situations where they may be afraid that it will come. Like, the panic attack in itself is not dangerous. That sort of like, no one will die because of a panic attack, and people don't go crazy because of the panic attack, even though they may feel like it. So like, it's not dangerous in itself, but it's so unpleasant that oftentimes people will take a lot of measures and like structure their lives so that they can avoid it, and that can have lots of negative implications for, again, their quality of life and their ability to function in whatever context they're in.
Yeah. I would say that, I agree with Dr. Torben. And one thing that I found that there is hope is that once the person understands what they have, and oftentimes this comes, the heart races very fast sometimes, they may have palpitations, and they may even feel like they're going to have a heart attack, or, there's a sense of doom, like there's pressure, or they're going to be crushed, I guess it would be the word. But once they know that this is not going to kill them really, even though it feels like it. And that they have control over that, that they can actually do certain things, that it's going to pass. It's going to be a few minutes, perhaps. Once they are aware of that, there's a lot of positive ways they can talk to themselves, breathe slowly in and out, focus on other things until those minutes pass. And so that they can learn how to deal with that. Of course, in some cases, if it's extreme and there is access to medications, they may take medications. But many of them are able, with time, to learn how to deal with that and control that, where, as Torben said, others not even know, because, it becomes a more positive way to deal. So there is hope, and there's ways that we can, and you guys who are ambassador leaders, as you learn about it, you can actually coach them and help them as well. And sometimes how to deal with a panic attack when it comes. Prepare. There's a sense of when to start to recognize when it starts to come, how they can, slowly breathe in, breathe out, focus their mind, their thoughts, controlling it. Even though what they're feeling is horrible, they can use their brain to tell themselves things that can calm them down and help them go through that.
And if I just may add, Pastor, to that you said this about people being attention seeking and sort of sometimes how we perceive people. Like, reality is that what we see in people, what we observe, is usually just the tip of the iceberg. I don't know if icebergs, that metaphor makes sense in South Africa. I come from Norway, where we know. So, but like underneath the surface, there's always in all of us a lot of things going on that we don't show to other people. Maybe we show a major part of it to some of those who are closest to us, and hopefully we have someone who we can show sort of everything that is below the surface to. But as we deal with one another, that's the case. Often we see just a small fraction of what's going on, and we don't know what the history of the person is. We don't know why they're doing what they're doing. So even someone who we perceive is just, even like you used the example, attention seeking, that can be very annoying when we see that we can sort of that can trigger negative reactions in us. But what I think is so important is that we always try to sort of look below the surface, even though sort of we can't be sure what's there. But in our mind, try to think like what is actually going on in this person, so that we just don't just deal with the surface and maybe the behavior that we find inappropriate or annoying or immature or whatever it is. Especially as we're dealing with young people, it's so important. Young people need someone who they can talk to, someone who will listen, who they can confide in, who they can be open with about the struggles they're facing in their lives. And you can assume when you see someone with behavior that is not a positive behavior, it can be addictions, it can be various things, like to just target the inappropriate behavior, then you're doing a mistake. Probably what you need, like as a leader, as a model, as an adult dealing with this, what you should do is try to get in a position with that individual where you can sit down and talk, where you can become a safe person that the person can talk to and share about what is beneath the surface. What is this, and how can you help this individual with that? As youth leaders, you can have a tremendous impact on the life of these young people. Because usually when you see some behavior that is inappropriate or negative, you can assume that they are struggling with something. And they don't have the tools, or maybe they don't have the people in their environment who they can share these things with and who can help them. And that's why it's so important that, like, the natural thing for us is to be judgmental and be harsh. Like we typically, it comes naturally, and sort of, it doesn't mean that we're bad people, that it does, but we have to be wiser than that. and be mature, where we say, how can I help this individual? What's going on here? How can I be of support to this individual? Because if we become aggressive, if we punish them, if we discipline them, that kind of things, that can actually make things worse if it's not done with love and care.
Well, thank you so much. We may sound like we're talking to ambassadors and ambassador leaders, but this also affects a wide range of our young adults and sometimes our parents. And I know you could be listening and at home at this point in time, and you're saying, I'm not an ambassador, but I also go through these things. This is exactly the reason why we're coming to you with this program. It's just that we just needed to fit it in some corner where we're focusing on ambassadors, but we are aware that you could be going through such frustrations as a parent, and also as a young adult, as a man, as a lady, as a father, as a mother, and so on. Look, before we can even go to our questions, I see Nomana wants to raise a question. Before we can even go there, and I've picked up that the responses we're getting from you, our guest, is actually twofold. It speaks to the very same ambassador on how to deal with these things as a person, as an ambassador, and also it speaks to us as leaders. How do we help them? Because, like I said before, I sometimes wish I could just punch my face, because I used to be like, what is wrong with this child? This is purely attention-seeking behavior. But I know I was wrong by being judgmental. But like you say, that our natural response to these things is being judgmental and think about a whole lot of things. And I'm very much impressed at the fact that you have mentioned that most of the time there could be underlying conditions which are actually a cause to whatever is happening, and which would need serious attention. And I'm happy that you are listening as a ambassador leader, youth leader at home, so that when you see these things, you at least know you are equipped as to how do you respond to such a situation. All right, this is my last question, then I'll open to others. I will allow this question to be part of the questions that will come from our VCs. Is it possible that someone can be depressed but still not know that he or she is depressed? I mean, you have someone who lives normally, and yet that person is suffering from depression or anxiety or something. Is it possible that you can have such a situation where someone has depression but does not know that there is depression?
Yes, I think we talked briefly about that, but I think, yes, you can. Of course, there's different types of anxiety, different types of depression, as we refer to. But if you talk about mild depression, let's say mild symptoms, there are many people that may have what we call subsyndromal depression, meaning they have some of the symptoms. They still work, they still, like if they're a young person, they still going to school, they're still trying to do the best they can, but they do not realize that it is actually a higher level of symptoms than that needs help, that they could actually feel much better if they sought that help and were able to deal with the cause of what they're feeling. Likewise with anxiety, same thing. Many, very common. A lot of people don't realize that the way they're thinking, the way they're reacting to life, to things, is actually unhealthy, and it may be a disease. It may be an anxiety that needs to be dealt with. And so it is very common, possibly, and that they may not know. And as I said, as I gave the example, I have found many people that once they learn the symptoms, what it really is, the levels, they said, I didn't know I had it. And there's one young person that I'm thinking now, was actually from South Africa. She was in a different country when I met her. Her parents were there. And she went and she said, I have all these 9 symptoms you mentioned, and I've been struggling. I didn't realize. She went back, she sought help, she got therapy, she got medication. I saw her again, she was a different person. So it is very possible that, yeah, you're living and struggling, doing the best you can. And now that you can identify it, you can seek help, you can see the difference that it can make in your life afterwards. Because there is hope. You can feel better once you get the right treatment.
Yes. All right. Thank you so much. I'll open up the floor now for a few questions that we may want to ask. Nomana, your hand has been up. Please shoot.
Okay. Thank you, Pastor Pome. The question that I wanted to ask is the difference between depression and anxiety. And I think mostly through the presentation, my question has been answered. Just like you, Pastor Mela, I had my own perceptions with this depression and anxiety, especially with the young people, where I thought that they were acting up, you know. So this topic for me is an eye opener. I think it's not an eye opener for me only, but to the ambassadors as well. Now I've learned that with the symptoms that have been thoroughly explained here, it's gonna be much better or much easier for me to deal with these young people, so that when I see these symptoms, I am able to refer them somewhere for help. Thank you.
All right, thank you so much, Nomana. So that it does not only end with prayer, because we sometimes think that we can just pray and that's it.
This is a very good point that you're making. Yeah, in fact, if you don't mind, if I can make a comment here on what you said and Nomana said, and you said, there is this myth that has been propagated quite a bit among ourselves, sometimes in the church, that, you know, if you're having some of the symptoms, it's because you're not praying enough, and maybe you don't trust God enough. Why are you so anxious, you know? And that maybe you need to be more spiritual. And if you do, then these things go away. And we hear a lot about that. So it's very important for us to realize that when you have diabetes, does that mean that your spirituality is at risk? If you're having a heart attack, does that mean you're not praying enough? Why is it that we think that anxiety and depression is different than, let's say, a physical illness such as diabetes or you know, hypertension? Yeah, you can pray all you want, you know, Lord, lower my blood pressure so I don't have a heart attack. But if you don't seek help and do certain things to change that the source of the illness, that doesn't mean that, you know, God is going to remove that from you just like that. And so we have to be very aware that there are faithful people, spiritual people, God-fearing people who do have depression and who sometimes do have panic attacks, and they need the help. And we shouldn't judge their spirituality, you know. And I just wanted to bring that up because it's so common. It happens so commonly in all around the world, you know, in our churches. And I think the more we talk about it, the better it is for people to realize it.
Thank you so much for that. Thank you so much for that input. It's very important. Now I will allow another question. Oh, I see there, Dr. Tobin, you want to say something as well?
Like, it's like what you're saying, so many thoughts come up, so we're like eager to share them.
Yes.
I'm very happy that you're saying, like, what both you and Nomana said, like, this is an eye opener. I think one of the problems we have is, and that's what I see, like many places around the world, everywhere around the world, people don't understand a whole lot about, we don't have a whole lot of knowledge about mental illness. And because of that, also that contributes to that we have prejudice and we have misconceptions and all this shame and stigma. I think this is one of the best ways to fight stigma and shame when it comes to mental illness, is that we talk about it, that we educate one another, so we understand that having a mental illness doesn't mean that you're crazy, it doesn't mean that you're stupid, it doesn't mean that you're weak, but that just as you can get any kind of like a physical illness, you can also have a mental illness. That's part of being human in this world. And it's part of being also a Christian and a follower of Christ, because we live in the same bad world as everyone else. And the same reactions we can have when we experience negative, bad things, like that happens to us as Christians and as Adventists also. We are not immune to negative things. And our emotional and our mental cognitive response to that will sometimes also be affected negatively by it. And sometimes this is like, I don't want to sort of make any kind of promise or illusion that if you just do all the right things, then you won't have any mental problems anymore. Like, this is something that sometimes we have to live with it, and we have to make the best of it. Many people live with chronic physical illness, and some people, sometimes because of trauma, because of war, because of negative experience, because of their genetics, their physiology, they will be prone and they will be struggling with various kinds of mental illness. But that doesn't mean that you will have a bad life. Many of the people, many great Christian people, maybe have become great because of their experience with suffering also, and that has helped them, shape them and form them, and in a way sort of ennobled them, I don't know if that's the right word, but it may have an ennobling effect even, that you get a deeper experience with life, you get a deeper experience with God, maybe you get a deeper experience with other people because you are exposed to suffering. So like, good things can also come out of mental illness. That may sound so paradoxical, but it's also a growth opportunity if dealt with properly.
Thank you so much. Thank you so much, Doc. Can we get other questions? We received quite a number of questions from our ambassadors and maybe also our young adults. And we have allocated VCs to be asking those questions. And we don't want to let you guys go without you answering those questions to our viewers at home, so that we can know how to go about these things. Any other hand?
Zanella has a hand up.
Yeah. Yes, then.
When we're experiencing this, the depression and anxiety, he or she develops suicidal thoughts.
Okay.
Suicide seems as an only option then. So how can one get rid of these suicidal thoughts? Because when he's overwhelmed by the pain of being depressed, he or she thinks only about committing suicide. So how can he or she dismiss these thoughts?
I can go first on that
Okay.
one. Suicidal thoughts is a very serious thing. Globally, there are about 800,000 people every year who commit suicide. So that's almost 1 million people, lives lost every year globally because of suicide. And this is all over the world, that suicide is a problem. And we know that sort of for every suicide that people, like every suicide, there are many people who make suicide attempts, and there's even more who have suicidal thoughts. And when I've dealt with patients, it's been rare that I've had patients who have said that they never had suicidal thoughts. So that's when people struggle mentally, that's very common. And I think that it's when we are having problems, we try to find solutions. We try to find ways out of the problem. And in a way, I think the suicide is sort of a way out. It's not a good way out of the problem, but sometimes people perceive that that is the only way, that they don't see any other option. And that's whenever people are having suicidal thoughts, that's when they need help and support, both by loved ones, by friends, by family, but also professional help with that. Very important. And suicidal thoughts, that's just a symptom of the underlying problem. And in order to deal with the suicidal thoughts, you need to deal with the underlying problem. But meanwhile, until you get to sort of solve, hopefully, the underlying problem, you need to take measures to assure that if you are struggling with suicidal thoughts, or you know someone who is struggling with it, that they take measures so they won't act on it. And that's also where you need a professional assessment for sort of what is the suicide risk. As I said, I've had many patients who have had suicidal thoughts, and I think many people can say that, well, at some point in life, I wondered whether life was worth living or not. That's not sort of an uncommon thing to have that kind of thoughts, but it's the severity of that. So that needs to be assessed, and it needs to be talked about. When someone has a mental illness, they're struggling, then you can assume that they're having suicidal thoughts on some kind of level. And I would recommend to ask them about that. And again, that's so important, not be judgmental about it. If they express, don't say, don't be stupid, don't do anything crazy, that kind of things. It's suicidal thoughts is a symptom of an underlying problem. And the focus should be on solving the underlying problem. But talking with people about that, it doesn't make things worse. Talking about them, encouraging them to get professional help, that this is dealt with professionally, that it's made an appropriate assessment of what the problem is, and then that it can be managed. So that's just some reflections on that.
I agree. Sorry, go ahead.
Just sort of like that, whenever someone expressed that, sort of our goal is not to just get rid of those thoughts and block those thoughts as soon as possible. Like, we have to be understanding and be compassionate, and then see the whole situation and deal with it.
Good. Yeah, I agree with that. And I think that, it's important. You asked, what do I do, right, if I'm having it? So I wanted to speak to the person, but also to the ambassador who may be the one who will speak to the person who's having it. As Torben mentioned, Dr. Berglund mentioned, talk about, ask the question without being afraid that by asking the question, you're going to make it worse. There sometimes the idea is that, if I talk about suicide, they're going to be thinking even worse about suicide. So I don't want to talk about it. So what do you ask? You ask, have you thought about killing yourself? Are you feeling like you want to do something and disappear? How are you feeling? So ask specific questions, because that person who is having these thoughts, actually, in many of the cases, they want to talk about it, but they don't want to scare people, or they don't know who to talk to. So if you ask, you'll be surprised. They might actually share and say, I've been thinking. So if they say they are, another thing as ambassador that you can perhaps do is actually go deeper. So do you have a plan? What are the things you're thinking about? And ask whether they are thinking seriously, having a concrete thoughts about what to do. And you'll be surprised. Some people will share, well, yeah, if I were to kill, I would do this, this, this. And so then you start to see it's a even more severe case. And if that is the case, if they do have a plan, or sometimes they may say, oh no, that just comes and goes. I don't think I would ever, really do it. So you will see by talking with that person where they are. If they are saying, no, yeah, I think I would do this, then it's more serious. Then you really may not even want to leave that person alone. Really ensure that somebody was with them, making sure that they have care. Because when the person is really in a high risk of suicide, they cannot trust themselves, for their own safety. You have to actually ensure that somebody is with them to prevent them from doing that. But as Dr. Torben said, getting the help is very critical to find out what is the root cause of it. Is it because of a deep ongoing depression that's been there for a long time? Is it because of some other more recent? Among young people, it's not unusual to see them wanting to kill themselves when they end the relationship, when somebody breaks up with them. And it could be a young girl, a young boy. So sometimes that may be the root cause. And the reason that comes up is because there's deeper issues on their own self-worth, their own value that they place upon themselves. Maybe they've had issues before. So dealing with that baggage inside, so they understand even if the relationship ends, my life doesn't end, right? But in order to work through that, they may need help to deal. Now, if you are the person listening right now and you're having this, so to seek help is one. It may be that where you are, of course, in Cape Town, I think or in Cape Conference, you probably have good resources there. Many times people may be isolated in a place where there's nobody they can really seek help. So what do? Does prayer help? Of course, the prayer does help, of course, in some ways to kind of find what purpose God has for their life. If they have very clear in their mind that there is a purpose for them, that, that these feelings that they're having is not going to resolve the problem. And that, in fact, if they know that most people who are even in the edge of committing suicide, they actually, if they could take it back, they would have. There was a study that was done from people jumping out of a bridge in San Francisco. And there was one guy, anyway, there was something that I read talking about the fact that if they could take it back, they would have. So a lot of times when they are in the time of doing it, it is too late. When they're jumping a bridge, oftentimes many of them who survived the San Francisco Golden Gate Bridge, they said, when I was in the middle of the air, I said I should not have done it. So in other words, sometimes it's too late. And so if people who are going through that realize and understand, what, I would regret. I know most people do, even though they cannot see it then, sometimes this can actually help them see, no, it's not a good plan. There's other ways to deal with what I'm going through. Seek God, seek somebody to talk to, tell themselves, we have power. Our thoughts actually can really help manage a lot of sometimes of the feelings that we have. And when we change the way that we think about things, our feelings oftentimes also change. And so these are just some of the things. If there's no way that you can get help, which is the first thing you should do, then try to really seek to change the way you're looking at the circumstances. Try to be, managing that in that way, and seek out God, pray. Try to find out. I spoke with someone who was a very fervent Christian who had deep issues with this, and they felt, when they're feeling about killing themselves, it's like it's so terrible, the mental pain of depression sometimes, that it's a relief. They find that if they died, it would remove that emotional pain of how hard it is emotionally and physically for them, even though we think, oh, it's just mental. Well, it's a deep pain that people feel, emotional pain that sometimes is unbearable. So, but she told me, this young person said, what I would do is really, it was prayer and God that helped me during those times that I couldn't get help, to really keep from doing it, because I knew that, and he gave me the strength not to act on it. So if you are in a situation where there is no way for you to get help, God will help you, can help you if you seek that. He will help. The Holy Spirit can help you change the way you're looking at your circumstance and give you a new vision, a new thought. That can be helpful in some ways. But seeking help still is, if you can talk to somebody, professional help is number one thing for sure. You want to do if you have access to it.
Thank you so much. Thank you. We now move on to Andeswa. She has been wanting to speak. Andeswa.
Thank you, Mfundisi. I've got a question from a young person. She's asking, can depression be healed without seeing a doctor or a therapist?
Okay, thank
Good
you.
question.
And I think I need to make a follow-up on that. I heard that Dr. Beckland said they need to seek for professional help, but because of some of the backgrounds that our young people are coming from, what if the young person cannot seek professional help? Can they find ways of getting help there? Also, if there is medicine or treatment, are there any side effects that they can get from taking the medicine?
The doctor
You can start, and I'll follow.
Well, mild cases of anxiety and depression, then oftentimes it's not so urgent to seek professional help. Then you can try with like social, relational, and lifestyle interventions to try to manage it. I've often said, sort of, if everyone had, like every person had a really good friend, then maybe I would be out of business in a way, or at least the need for professionals would be much less than it is. So having someone, and this is sort of, if you don't have access to a mental health professional, then sort of, if you have a person that you really trust, a wise person that cares about you, someone who you can be open with, someone you can talk with, someone you can share with, there can be a lot of help in that. And as Katja mentioned also, like there's lifestyle things we can do, like we optimize our sleep, optimize like exercise. Exercise is very efficient for some kinds of depression and anxiety, and eating properly, connecting with other people, being social. These are things that sort of everyone should do if they're struggling with mental issues. But again, I sort of think that if you have the chance, if you are able to see a professional, then why not do it? Like if my car is broken, then I want to take it to the garage and get it fixed by someone who know what they're doing. Or if my phone is broken, then I won't just try to fix it myself. That would just maybe make it worse. I would take it to an expert who can see it. So that's something I like. If a professional is available, then I definitely would recommend to see a professional so you can get the optimal treatment. And as I said, also sometimes depression and anxiety, they can actually be symptoms. They're maybe not the core illness in themselves, but they can be symptoms of other things. And then you need a doctor, a health professional who can make that kind of assessment, who is trained in sort of exploring what is this. So, but always with mental illness, there's a lot of things we can do and should do on our own in order to optimize our lives. But that doesn't exclude in any way, and shouldn't exclude in any way, also making use of professionals who are experts on dealing with this.
Mm-hmm. Yeah, so just adding in, I agree with Dr. Torben on that. I think that what the trick here is, if the person is in major depression, sometimes they have no energy to even cook or exercise, or the fatigue is so deep sometimes that it's hard. And if they're able to access a medication, that can some ways balance their chemicals in the brain, and then they may have an added energy to be able to do the lifestyle things that are very important. It doesn't help for them just to talk to a professional or take a medication and continue to have terrible sleep habits, no exercise, poor relationships, or being abusive relationship that is adding to the trauma daily, or things like that. So again, you have to look at the root cause of what is happening, and sometimes a professional can help you identify that. But even if you don't have access to a professional, being able to go through the symptoms and say, okay, how is my lifestyle? Is my sleep okay? Am I exercising regularly? Am I dealing with stress that is really impacting me? How am I dealing with that stress, with that or with that trauma that I've experienced? So do I have somebody to talk to? So, kind of like going through the list of things. And if it is, like you said, a mild case, we see that oftentimes just adding the exercise, just improving sleep, just dealing with the thoughts, trying to ask God for help to change from a pessimistic view to an optimistic view, from a negative outlook of yourself and your identity to a positive one. That is something that God can help us with too as well. And positive relationships with people can help us to see. If you have friends, for instance, that bully you, that make fun of you all the time, if you're a young person, that put you down, you may want to choose different kinds of friends, because that will help you in your own mental health as well, and your own feelings that you're going through. So those are some of the things you can do if you don't have access to health professional. But if you do, you want to do that for sure. The other thing is addictions. As a young person, sometimes you start to fall, whether it's for influence of friends or even because you want to feel better about yourself, and you end up seeking a way to numb the negative, painful feelings you have through addictions such as pornography, such as gaming, video games. That actually is going to make you more prone for depression, more prone from mental health issues. So cutting some of those unhealthy habits that are root causes as well for depression may be another way that you can help yourself to deal with the root cause. So evaluating your life and how you spend your time, the relationships you have, and all of these things together, and of course your relationship with God too does have a role. All of those things can help somebody who is struggling.
Thank you. Pastor, I see you're unmuting me. Don't unmute me, because I've got two more questions, follow-up questions on what has been said.
Oh, you asked a question, Andiza, that I don't think we discussed. It was the side effects of medications.
Yes.
And it's important to point out that, particularly among young people, there are some medications that sometimes when the person starts to take, they may have energy back, they may feel better, but there's an increased risk of suicide. So, again, the importance of sometimes following up with the health professional. But I do think that most medications that we have today compared to 10 years, 20 years ago, have a much better profile in terms of side effects. And so, in other words, they have less side effects, perhaps, depending if you have access to those medications. So I don't know what kind of medication they would have access there, but following up with a professional who prescribes is important to avoid, increased suicidality and other kinds of, they may need to change medications, in other words, sometimes.
And what is important is when it comes to medication is that what side effects there are, they are almost always what we would call reversible. When you stop with the medication, the side effects will go away. So this is like, there's never any sort of permanent damage done if you try these medications. And that's why when I work with patients, I'm often a bit like sort of conservative, careful, like it's that I'm not very eager to start patients with medication unless it's a really severe situation. But what I always say, sort of, you can try it. If it works for you, good. If it doesn't, then we can stop it again, or we can try something else. So there's nothing lost in trying. And I think that's very important to say. But again, usually for depression and anxiety, medication in itself is not the final solution or the only solution. There should always be more. Medication usually doesn't sort of deal really with the underlying issues, the root causes. We have to deal with them. But as sort of like if you break a leg, then the doctor would give you say, pain medication, so you can recover quicker, you can deal with it, you can survive and get through it. Sometimes the medication we give for mental illness has some of the same effect. It can help you get through it quicker and better, so you can recover faster from it. So again, that usually these medications that we give for anxiety, depression, they're rather mild medications, and they usually don't have a lot of side effects or severe side effects. But it can always, if it doesn't work for the individual, one can stop with it in collaboration with the doctor. That's important to say with these medications. It should always be done under the supervision of the doctor. You shouldn't just like quit yourself, because that can also give very unpleasant reactions and potentially dangerous reactions. So whatever you do it in collaboration with your doctor.
Thank you. Can I ask a follow-up question on what has been said?
Okay, make it quick. We are running out of time.
All right.
Yes.
Dr. Renette said something about unmodified causes of depression.
Okay.
And I'm thinking now, because of our background, most of our ambassadors, they definitely go through some of the stress-related causes, né? Like hardship. Some of them, they even go through rape, and some of them, they are coming from broken families. Yes. Now, my question is, if an ambassador is going through such things and is going through depression, can that young person be helped?
Oh, that's yes, and thank you for asking that question. When I say modifiable, I mean they cannot change what happened to them in the past, right? Or having a hereditary tendency or risk. But that doesn't mean that they can't do something about it to prevent it. So again, some of the things we discuss here, particularly in regards, like let's say somebody who's experienced sexual abuse, somebody who has had trauma, broken families, or all kinds of hardship that I know are very common, not only there, but around the world. And so in order to be able to be resilient, in other words, to face that and avoid the risk, because what we do know, the research does say that shows that those experiences increase the risk for depression, increase the risk for anxiety and other things. So there is a potential risk, but there are things that person can do to be resilient, to actually deal with that circumstance in a positive way and bounce back and not fall into depression, right? And what are some of the things? A lot of it has to do with dealing with what they went through in a healthy way instead of in a negative way. But that there are many factors. Personality may be a factor. The support system they have. Do they have you as an ambassador, somebody who they can trust to talk about what's happening at home, who can be a support to them, confidentially, without, sharing with other people, but really be a help? What we find is that young people, or anyone who actually, we're particularly talking about young people, if they have an adult in their life who they can trust, who they can open up and talk about those experiences, who can empower them and help them see themselves through that process, that is a positive thing that can actually help them to be more resilient. If they are able to, again, if some of the things we mentioned are important in terms even of lifestyle, but if again they have an identity themselves in Christ, regardless of what happened to them, and they know who they are, they have a purpose, and they are able to use their gifts and what they have, because everyone, the Bible tells us this, and everyone, no matter what they've gone through, they have something to contribute. Many people face their own hardship by being a blessing to other people, by using their gifts to be a blessing to others. And so there is also a way for people to be resilient. If they are optimists, if they have altruism, those are things that optimism and altruism are things that have been documented as very powerful to help people overcome some of these tendencies or experiences, and being able to channel what they went through in a positive way to bless other people. And that way it heals them as well. And of course, their relationship with God during this process is very important. We know, and there's plenty of research that shows that if people see God as a loving God and not a punishing God, if they see God as the one who, even though that happened to them, but God was suffering with them through that process, and he hurt also as they hurt, and not as a God who said, see, you deserve that. So their view of God, if it is a positive view, and they can use their faith as a positive coping mechanism, instead of having a relationship that faith becomes negative in the way that they cope. So they feel forgotten by God or punished by God, or that God is punitive. That actually brings worse mental health outcomes. And so helping people develop this healthy view of God, of loving God, and we already talked about this relationship that we have with them as mentors, can really help them deal with whatever they've been through or are going through in a way that's positive, that can help them be resilient and help decrease the risk for depression and anxiety.
Can I know
All right.
time, but it's just something that I think is very important to say in this context.
Okay.
If there's an ongoing problem with being in some kind of relationship where there is violence or abuse, then that is something that is never acceptable. If that cannot be changed, and I think this is very important to say to young people also who may be listening, that if you are in a dating relationship or something where the other partner is clearly like violent or abusive, physically, emotionally, sexually, or spiritually even, then that is not probably a relationship you should stay in.
Mm-hmm.
Like it's not sort of, it's abuse, that kind of abuse, whatever kind of relationship it is, it's something that we need to change. We shouldn't remain in a situation. The people who are close to us should be good people. If they're not, we ought to see either can the situation be changed, or we need to distance ourselves from them. And especially as a young person considering a life partner, whenever there are signs of abusiveness, like physically, sexually, mentally, spiritually, think twice, think 3 times, think 10 times before you move on.
I would say don't move on.
Yes.
Get out, because
Get
it's
out.
not gonna get better. It
Of
will
course.
get worse.
Yes.
Never get better. So get out. Yes.
I
think that's what you meant. I think that's what you meant as well.
That is sort of, that's like we had in our relationships, we should have 0 tolerance for abusiveness. And that's also, that applies to ourselves also. It's not acceptable that we are abusive or violent in any way to other people. That's not being a Christian. That's not being a follower of Christ. So that's 0 tolerance for that.
Yeah, and that's so important that maybe you need a whole program only on that topic.
Of
maybe
course.
Another one.
Yes, we will. We will look into that. We'll look into that. Thank you so much. At this point in time, I'm going to just give one person to make a comment, and then Pastor AJ will make closing remarks, and Pastor Fassenberg will pray for us. Cindy, just one comment before I go to Pastor AJ.
Okay, thank you, Mfundisi. But I have 2 questions, Mfundisi. The first one, I think they have covered it. Maybe they can just go over through it. It's saying an ambassador who wants to know what are symptoms of depression and anxiety. Then I have a second question. This one is saying that if your parent doesn't understand you and they compare you to other kids, and this is depressing me, how can I get help for my parent?
Yeah. I think maybe we can give time for the second question. I think it's very important. The first one was touched.
They've covered it.
Yes. Can we get a response, a short, quick response to question 2?
Sure. Do you want to start, Corbin?
Yes, go ahead.
quite get the question. So like I can leave it to you, Katja. You can, I'm sure you
Okay.
can.
Well, from what I understood is a young person saying that they're experiencing the parents may have or show a preference towards a child, and they feel kind of rejected. And so was the question how they can help the parent or how they can help themselves?
How can they help the parent? Because
their parent,
because the
okay.
parent is
Yeah. Well, that is a very
parent has
tricky
expectations.
Yeah.
Can I talk?
The parents' expectations of them. So the parents is comparing them to their sibling and has expectations of them. Well, certainly I don't know the specifics of the situation. First of all, very important to know exactly what is happening. Is this question coming from a standpoint where, let's say, a child is being disobedient and the other one is more obedient because of temperament or personality, whatever, and the parent is say, why can't you be like your sister because she does everything I say? That is one thing. But so anyway, this question, to really answer it appropriately, we need to talk more about, parenting skills. But I would say, if the person is asking that they're feeling bad about themselves because the parent compares them with their siblings, they are in a situation as a son or a daughter difficult because the parent actually is the one who has not the power, but the authority in the home. So they can say, why are you doing this? And it may disrespect, but what I would suggest them to do, try to talk to the parent in a non-threatening, in a kind, a very open way, if it's possible. Not every situation is possible, but try to say and say, Mom, Dad, I'd like to talk to you. I don't know if you realize, but when you say that, this is how I feel. And try to share what they're feeling, in a situation with a parent without being disrespectful, without, yelling, but really approaching them. First pray and then approach them in a way to try to express and say, I want to be a good son. I want to be a good daughter. And it's not my intention to I don't know what the parents are telling them they're doing that they're not happy about. So I don't want to. It's not my intention to be a negative son or daughter. But this is how I feel. Is this what you mean? And try to talk to the parent if possible. Not every situation is possible. Sometimes the parent may become even more, abusive. I don't know exactly what's going on in that home. So they have to, I think, seek wisdom from God first to find out what is the best way to approach this with the parent. If it is a parent that is open to communication, the conversation, they can try to do that and then open it up with them. But if it is a situation where the parent doesn't have that opening, then the best thing I think is for them to, again, try to not allow the words they hear, if possible, to define who they are, but find their identity in who Christ thinks they are. And hopefully, be able to have an adult they can talk to that can help them as well to really see themselves and the good that they have to offer, what the value that they have if they cannot get that at home. Anyway, it's a tricky situation. It requires a lot of
tricky one. Of course, it's probably a topic on itself, which may need time enough to look into it.
Yeah.
But I think it's best to just say to that ambassador, people's ideas about you are basically not what God is thinking of you.
That's right.
Yeah. Pastor, yes, Dr. Tobin, your last comment.
Yes, when people treat us badly, then sometimes we are also just seeing the tip of the iceberg, to use that metaphor again. Oftentimes when people treat us badly, it says more about them than it says about us, but usually we take things personally. That's our natural reaction, that we are hurt, we think it's about us. But oftentimes that kind of behavior, it's a reflection of some kind of struggle or some kind of pain, some kind of issue that person is dealing with. So that can be a way sometimes to try to help us to manage and cope and stay positive in that kind of situation. Say that because this person is yelling at me doesn't mean that I'm the problem. It can be that that person is having some kind of problem in their life and they're just taking it out on me. And that can even apply in a family context with parents. Parents also have problems. Parents also struggle. And sometimes they take it out on their children, not because they want to be mean or bad parents, but because they don't have, they're not able to do it better. So again, as we're dealing with one another, like always looking for what's beneath the surface that can help us to deal with situations. I'm not saying that to sort of that we're going to excuse bad behavior. That's not that, but it's just a strategy for thinking about things, reflecting on things, and coping with things, and not taking things personally necessarily.
Yeah, and for the ambassadors, it's good for them to understand this. Sometimes, though, for the adolescent who is a young person, sometimes it's hard for them to have the frontal lobe, the ability to think through all of that themselves. So that's why it's even easier for them to take it personally. If they're young, particularly, they don't have the ability sometimes to look beyond what's in the iceberg. But as ambassadors, knowing that, you can perhaps help them. Yeah.
All right, thank you so much. Pastor AJ, I think you are ready for your closing remarks.
All the way. I would like to thank everyone for participating. I think this is a very good topic. I think it's a very important topic, and it's something that is applicable to each and everyone's life. And I think this concept of anxiety and depression, it goes across the whole board and over all age groups, if we can put it like that. And if we can take this to heart, my request is, and maybe this is also a question, how do we now continue after this message, after this discussion? What's the next step? For instance, there might be a young ambassador or a young teenager or even an adult who's struggling with depression. What's the next step for them to actually take to help him sort this out? And I think that could be our wrapping up of this discussion. What could we do?
And of course, we would appreciate straightforward points. And thank you, Pastor AJ, for that. Just to say, when this happens, do this. I'm not even sure if we're not putting you in a tight corner. But
no, I think it's a very good practical things. For one thing, I would say, start to you gave various examples. The beginning is first step, I think, is to learn more about what you're going through. Now you've learned about a little bit about depression, anxiety. Try to read, try to learn more about this condition. Seek help. If you as you see yourself with the symptoms and some of the things, seek help if you have the ability there and access for a mental health counselor, sometimes your own health practitioner there. And also, do what as you learn about it that you can do. We discussed some here. Try to look at your lifestyle, try to look at what you can do as well. So 3 basic things there, I think.
Thank you so much.
I would recommend to, in the aspect of educating yourself, like how to help others on that, if you're an ambassador or it's a family or something. One resource that I would recommend to look at, it's an organization called Mental Health First Aid Australia. If you Google Mental Health First Aid Australia, they have lots of very good resources on various topics for lay people. Like the concept is, this is first aid. First aid is something we all should be able to give and provide. And this is the concept there. So this is like what you as a lay person, not a mental health professional, but what you as you deal with family, friends, or youth in your church or whatever it is, how you can help them. So if you go to their website, Mental Health First Aid Australia, just Google it. Then they have guidelines for depression, for anxiety, for eating disorders, for suicide, addictions, various kinds of things. And this is very good quality, what they're doing. So I think that's, again, you're helping yourself to help others better, but you can also become, in a way, more confident so you don't get so stressed yourself, wondering sort of, how do I deal with this situation and what do I do? Get some guidelines, get some advice on how you can do it. I think that's a good place to go.
By the way, this program he mentioned is available in Africa as well. So look for Mental Health First Aid, South Africa. I think you also find it, you know, contextualized for Africa as well.
It's an international organization, but some I know, sort of the US part of it, you don't get access to the resources. You have to be a member or something and pay for it. But the Australian, there they have lots of stuff on their website, so you can get access to that without having to go through their training. But if you can go through their training, I think that's also recommendable to do that.
All right, thank you so much. Thank you so much. There you are, ambassadors, and also parents, ambassador leaders in our local churches. This was for you. Do we have enough time to discuss these things? No, we don't. We wish we could stay around and ask more questions, and even allow you at home to ask questions. But unfortunately, we have this so much time to work around this. And maybe let me ask my dear Pastor Mornay to just say a word of thanks, and then after which he will also close in prayer. Let me see if he's here. Yeah, he is here. Mfundis, just a vote of thanks, especially to our guests and viewers at home.
He's muted.
Yeah, please unmute.
Am I unmuted? Can you hear me?
Yes.
Yes, yes.
Yes, good. I just want to make sure. So I just want to thank our two presenters here, Dr. Katja Reinhardt and Dr. Torbjörn Berglund. Thank you that you could have been with us tonight. It's not always that we have visitors from overseas that come and join us here. So there's something good in being in lockdown. We can get people from all over the world to come and talk to us. So thank you very much for making yourself available to be with us tonight. We appreciate it very much. I also want to thank all our vice chairs from the different YCOMs that is here present tonight. Thank you that you've been here. Thank you for your questions. We appreciate it so much. And I think it gives us a good idea. Like Pastor Bomela said, it is not something that can be discussed and topics that we can have all the angles in an hour and a half's time. It's just too big. But thank you for bringing it to us. We appreciate it so much. I think it opens our minds a little bit, and thank you for the resources which we can go to and find a little bit more out of it. Pastor Bomela, I want to thank you for hosting the program here, and Pastor AJ de Villiers, who organized the speakers for us. And then once again, our listeners and our viewers out there, the parents and the ambassadors, this is for you. Make use of it. And I can just say, God loves you always, no matter who you are, no matter where you come from, no matter with what you struggle with. God always loves you. And I'm going to ask you all that we bow our heads and as we do a closing prayer. Our dear Heavenly Father, what a wonderful privilege once again on a Sabbath evening for us to talk to our ambassadors and to talk about things that is very important to us, things that is actually happening to some of our people. Father, we all of us sometimes struggle with a little bit of anxiety, with a little bit of depression, but some of us sometimes struggle more severely with it. And we want to thank you tonight for our presenters, for our doctors that has been here with us. Thank you that you give them the knowledge that they can come and share with us. Thank you for the pastors who have organized this program for us tonight. Thank you, dear Heavenly Father, that we could have had good online service and that all our programs could go out tonight. We know your hand of protection was even over our internet systems. Father, I want to pray for the ambassadors, all of them. But tonight I want to especially pray for the ambassadors that is struggling with anxiety and depression problems. May you be with them. You are the God that created each and every one of them. You know them by heart, and we know them through all the medical professionals that you can help. Father, thank you for providing them for us. Thank you that you are our God and that we can always go to you. I also want to pray that as we go through life, that we will not just run to people, but that we will firstly come to you in prayer and always ask you for advice to lead us and to guide us, because you are our God and we can trust in you. As we will go into this night and have a good night's rest, Father, I pray that you will bless us as we wake up in the morning to have a blessed Sabbath together and worship you once again together. We all ask this in the wonderful name of Jesus Christ, our Lord and our Savior. Amen.
Amen. Folks, thank you so much. This is where we end. We hope to see you soon. And I mean it. Our guests, we hope to see you soon.
Amen.
We will call again. Yes, thank you. Pastor AJ, thank you so much. Cindy, thank you so much. Andiswa, thank you. Nomana, thank you. Zen, thank you. God bless you. Enjoy the rest of the afternoon. If you